Spinal cord stimulator is a procedure that we do here. It's for usually chronic pain. It could be back pain or leg pain. They make an incision in your mid-back about like this, where they can go in and remove a little bit of the bone so that they can get the leads on the spinal cord stimulator. And then you would have a incision in your lower back off to the side, or sometimes in the buttock where they put the battery pack. And the battery pack is going to be about that big, and it just kind of sits in our fatty tissue. And you control the spinal cord stimulator with an iPod. So you can control it with this iPod thing that the spinal cord stimulator people are gonna tell you how to do. And it's easy to learn, don't worry about that. A lot of our patients feel very comfortable using it. But that's an outpatient procedure. Usually they do put you under kind of light sedation so that our surgeons can make sure they've got the leads in the right spot. You won't remember talking to them, but they can ask you, is this taking care of your pain? You can go home that same day. You do have to take it easy with that surgery. You don't want to do anything to make your incisions not heal, so you're gonna not do any heavy lifting or too much bending, twisting for the first 3 or 4 weeks. We usually don't turn the stimulator on until you come to that 3 or 4 week appointment, because the area needs to heal before we start stimulating it. So some people think that they're gonna get to use it right away, but it's that first 3 or 4 week appointment where we start letting you use it. So think of a spinal cord stimulator as like a TENS unit. With the TENS unit, you put the leads on the outside of the skin, and it just kind of blocks those pain impulses. But with a spinal cord stimulator, you put the leads on the spinal cord, and we think that that just blocks those pain impulses so that you don't feel the pain. And it's very effective. A lot of times people who maybe don't have surgical options, or the surgery would be a very big surgery and maybe medically that's not appropriate for them, so they can get relief with a smaller surgery.